How's it going, everybody? Welcome back to the channel. My name is Gianluca, aka Dr. Calcagno, and we're here today for another interview video. I have a really special episode today. I'm really thankful that Gavin reached out to me. I'm going to let him introduce himself and tell you a little bit about his story. But I think that there's a lot that a few students could really learn from his story and some of the stuff that he has to share today. So without any further ado, Gavin, feel free to introduce yourself, please.
Thank you, Gianluca. Hi, everyone. Thank you for having me on your program. My name is Gavin Tyndale. You can call me Gavin. First and foremost, I'm a Jamaican medical trained doctor. I'm born and raised in Jamaica, which is known as a small multicultural country. So I've spent some time, I've done my residency home, I've done med school at home in Jamaica. After med school, so at home in our medical system, there's a mandatory 1 to 2 years of internship, 2 years.
Mhm.
So that was done. Then I spent a year, 2 years in general surgery as a medical officer, which is like a junior resident, but not in training. And then after I went into the surgical residency program full-fledged at the University of the West Indies, which is the only training institution throughout the entire Caribbean. So everyone from every Caribbean country comes to Jamaica, and I think by extension, maybe Trinidad and Barbados for training. So that's just even amplify our multicultural society. So I've done like a year and a half, well, a little over a year. My family was here, so they urged me to come over. So I came in September 2022, which is approximately about 6 months now, and did the exams and I matched, and I'm soon to be another PGY1 in general surgery at the University of Toronto.
Very nice, Gavin. I was telling you before, but congrats again on everything. I'm glad that the process went well, and I'm glad you can maybe shed some light a little bit onto how you did it and why you did it. I know you said you have your family here. What program did you match into? Are you happy to share it, or do you want to maybe keep it a secret? You let me know.
That's cool. I matched into general surgery at the University of Toronto.
That's really awesome. How many spaces were in that program that you matched into?
All right, so there were two universities offering general surgery this year. So University of Toronto had three spaces, three spots,
Mhm.
and University of Ottawa had one spot.
Okay. And this is for the IMG pool, I guess.
IMG pool, that's right.
Got it. Got it. In terms of the application process, and you said you wrote the exams, but you're already in your residency program back in Jamaica. So how did this all start? From being in residency to slowly making the process towards now residency here in Canada, what was the first thing you had to do, and how long ago did you get started with all that?
All right, so I think it's almost like a crash course. So not exactly a cheat, but I've had friends or colleagues who were in residency programs in Canada, so I kind of had them on the back burner.
Hmm.
Um, there was one in ENT, and I have another friend who I met. He's in general surgery, also at the University of Toronto, not Jamaican. So it was at the end of my first year, PGY 1 year general surgery in Jamaica at the university. My family were like, you should join us, come over. Um, Gave it some thought. Then around August, I decided, all right, let me give it a shot. So I left Jamaica September 7th. That's like a Wednesday.
Okay.
And I sat the QE1 Friday, which is the 9th, 2 days after.
Okay.
No rest. So I must say though, like a few weeks leading up to the exam, I was studying. I must say hats off to you. I've been following your videos, your tips, your tricks. So you also played a major role. So I've been following most of your videos. And so I sat QE1 September 9th, 2 days after landing.
Mhm.
Then I sat the NAC OSCE, which is the all IMGs must do. It's like an OSCE exam. I did that exam 5 days after sitting the QE1, and I had to go to Ottawa. I didn't know where Ottawa is, so I just took the train, got a hotel, and then yeah, I sat the exam.
For those of
Um,
you that don't know, by the way, Ottawa is so if University of Toronto, downtown Toronto to Ottawa is about a 5.5 hour drive. So for someone coming in to Canada really and not really knowing where everything is, that was quite the drive you had to go to get from one place to the other.
oh yeah, and I had no drive, so it was all public transport. So
Wow.
I took the train, and I got a hotel and everything. Yeah, did the exam for my way back. Um, for the application period process. Again, hats off to you. I watched your video. You gave me the step by step. I was going through it. Um, so that started. I didn't start the application process until after I got back my results. So I got my results back maybe like the end of October, middle of October. Application was open like I think around that time. But I started in November. So I did like a quick crash course. I I stayed with some family members in Belleville, which is a small rural community, which is 2 hours east east of Toronto.
Mhm.
Um, I called every family physician around, asked for some experience, give me some Canadian healthcare experience. I need to get in the program. I need to be competitive. Didn't get any general surgery experience, but I got some family medicine experience. But I have already secured two reference letters from back home, one from a general surgeon, one from an orthopedic surgeon.
Okay.
And my third one was from a family medicine, family physician. And yeah, I put it all together, took my shot, and it worked. I must say though, I only got one interview. So my story or my pathway is, I guess you could say, a risky one, but I guess in the end it paid off. I applied for family medicine as well, and I think orthopedic. But I think what happened was that when they looked at my resume, I'm assuming when they look at my CV, all they're seeing is general surgery, general surgery, general surgery. So I guess they're saying clearly he's not interested in,
Well, you
so
were a general surgery resident back in Jamaica and you came over here. So, yes, I would assume that a lot of your experiences must have been coming from general surgery. You touched on a few things, which is nice. Thanks for doing that. First of all, for people that don't know, the NAC OSCE is a very important part of the IMG application. If you did your medical school in Canada, then you don't have to do the NAC OSCE. But if you didn't, then you have to do it, and it's weighted along with the MCC exams. It gets used in the calculation to help you determine how competitive you are when you apply. If I had to just ask you now, between the MCC and the NAC which one did you think was harder?
uh, right off the back, MCC QE1.
Okay.
The question types are different, especially when it comes to ethics, things like MAID. That's not practiced in my country in Jamaica, so it's quite interesting to learn about that. The question format, the matching. I think there's a part where the CDM part,
Yeah, at the end.
matching and so on. Those are quite unusual to me. So I will say that too. That was quite the interesting exam. It's quite unusual for me. So yeah.
Yeah. I've heard something similar for sure. How long did you study? Were you able to do it in about 3 months, or did you take longer or less?
Maybe 4 to 6 weeks max.
Wow, good for you. Very
And that
impressive.
was during residency. That was during
Yeah,
residency.
yeah. Very good stuff. Yeah, I mean, I know a lot of us here tend to do it in about, yeah, 4 weeks. Some people do a little bit longer. But the thing about the Canadian students is we don't really need a top tier score. And I know for you, you were probably going for a higher score. So good stuff. The other thing that I wanted to ask you, you said that you reached out to a few family doctors in the area to get some clinical exposure. Was that hard to do that, or were people pretty accommodating to get you in?
All right. So one thing I must say, I guess as tips for IMGs, you have to be confident, you have to be assertive. You have to reach out there. So, like I said, I got in Belleville, rural area. I figured maybe if I was in Toronto, it'd be more easier. But in Belleville, I guess it's quite unusual for them to have an IMG reaching out. So I just called every family physician office, explained my situation, tell them my goals, my plans. A few took my information. I think the issue was they were short staffed or some physicians going on leave or something. So, but at the end of the day, all I wanted was one yes. Like I could take 1,000 no's, just give me one yes, and I got that one yes, and it worked out.
That's amazing. Yeah, and like your interview story shows, sometimes all you really need is that one, right? So putting
Yeah.
yourself out there until you get it, and then it pays off in the end, right?
Oh yeah,
Listen,
definitely.
I want to ask you more about you, man. You seem like a really cool guy. Tell me about your training back in Jamaica. What was it like working as a surgeon there? Is it different than what you've seen here so far? Anything you want to share?
Oh yeah, sure, definitely. So during general surgery back home, we do get quite a bit of, depending where you are, you may get a bit of trauma.
Hmm.
We are still in terms of laparoscopic procedures, laparoscopic cholecystectomy, that's fine, but in terms of colectomies, so we're still kind of growing.
Hmm.
But we're more of an open laparotomies are what we perform mostly. Uh, we are trained. Unfortunately, we do not have a lot of, depending on where you are. So before I started residency, which is in Kingston, the corporate area, so there's a lot more resources there. In my hometown, it's CTs and MRIs aren't that readily available. So we had to rely a lot on your clinical acumen in order for diagnosis, and so on.
Mhm.
So yeah, and it's quite hectic. It can be very challenging, very hard. Another thing I must say, I realize is a difference here is back home. Doctors at home, we do IV accesses, blood works, blood cultures, urine cultures. So you're seeing a patient, you're doing your soaps, plus you have all these work to do, plus you have referrals to do, plus you got consults. So your hands are pretty tied up back home. So it can be pretty hectic. I must say it's a pleasant surprise to see that nurses are more involved. Here I see nurses doing IV accesses, blood work, blood cultures. You got PT, OT staff, occupational therapists, physiotherapists. Those things do help, and I like the holistic approach. Yeah, so I'd say that's the difference so far that I see. Mhm.
Got it. And I will say, I've seen that too. I know myself, before I had gotten into medical school, I didn't have many people in I didn't know where the responsibilities of the doctor really stopped. And thankfully, if you're in a center that is not a rural site, like if you go up north, rural Ontario, then yes, you do have, especially in my case, family doctors that have to do a lot. But when you're in an academic hospital, I know in Toronto, you will likely be in an academic hospital. Thankfully, there's all these other people that do help and help distribute the workload a little bit too.
Oh yeah, oh
Yeah.
yeah.
Gavin said something just for people listening. I know some people are from undergrad, from medical school. I don't know where you are in your training, but he had commented on the difference between laparoscopic procedures and open procedures. Whereas when I went through my general surgery clerkship rotations, as much as possible, things are have transitioned here to be laparoscopic when they can be to help reduce risks of infections and operative complications. But when you don't have access to CT and other scans that can help you plan out surgeries beforehand, I'm not surprised that things were a little bit more open back home.
Mhm. That's right. That's right.
Yeah, very, very cool. So then now that you're here, and I know you said you had family that was here and then they kind of pulled you over here too. Was there anything else that you were really looking forward to about the Canadian system?
Yes. So there is a partnership between the University of the West Indies and the University of Toronto. So I guess things come full circle, go full circle. A lot of my mentors back home, they did their fellowship at the University of Toronto. Also, during residency, when you're in your penultimate year, your elective year, you can apply to do your elective. A lot of our residents, especially general surgery residents,
Mhm.
do their electives at the University of Toronto. So being in residency back home, I've always dreamed of or had the intention of coming to UofT to do my elective. So like I say, it's pretty amazing that everything comes full circle that, I'm basically getting my dream and some more and then some. So yeah.
Yeah, no, that's really cool. I myself being in family medicine, and I'm a McMaster guy. I did my med school McMaster and now my residency in McMaster. But I've heard great things about the U of T's surgery program. So we're glad that you're there. Why general surgery though? I know you said you did maybe back up with family and you had a little bit of orthopedic intentions in there. But at what point in your training did you think general surgery is the way that I want to go?
Uh, Good question. I think it started in my third year, my clerkship year.
Mhm.
At my first rotation was general surgery. Before that, I realized even when I'm studying anatomy, I've always had a knack or inclination to abdominal anatomy. So that came pretty easy to me. I remember specifically one time I was reading about a hemicolectomy, and I just couldn't picture it in my mind. Like, how could you take half of an organ or half of a colon and reconnect or reanastomose it with the small ball? And then in third year, when I joined them or went and observed for a hemicolectomy, I was like, oh, that's pretty awesome. And then I've always been a trauma guy. I'm an adrenaline junkie. I do shark diving. So
Have you seen some
trauma,
of my videos? Do you know that I do shark diving too?
yeah,
Oh,
yeah.
that is awesome. I've never met someone else on here that's in. Tell me some stuff about it. Yeah, tell me more.
Oh yeah, sure. Yes, I do shark diving. The most recent one I did, I went bull shark diving. That's free diving as well.
Wow.
That's in Florida. So, and you know, bull sharks are like the third most dangerous sharks in the world. Just putting it out there. So, I am an adrenaline junkie, but so yeah, in Gen Surge, there's a lot going on, and I think diving helped me out with that. In that, when I go shark diving, there's a lot of stimuli happening. You got the waves, the ocean, the depths, the sharks, for sure, the weather. You just got to keep calm. You got to be aware of everything happening and be focused. And I took that with me in residency. I took that with me during my clerkship, internship as well. That a lot of things are happening around you. You just got to be calm, be aware of the situation, be focused, and if possible, control it. So it did help. But yeah, I've always loved the action of general surgery. I like the idea of actually going in and fixing something and then coming out. No disrespect to any other specialties, but I do see like stab wounds, gunshot wounds, MVAs, motor vehicle collisions, and we just go in, do what we need to do, get out, and save that life. So general surgery has always been that passion of mine.
And that's listen, I'm taking no disrespect from that at all, right? Like, if you as a general surgeon can't say that general surgery is the best specialty, then who will, right? Like me as a family doctor, I tell everyone family medicine is the best specialty in the world. And I truly believe that. And it seems like you truly believe that as well. I think that's the right way that you have to go into your specialty training, because otherwise you're not going to make it out on the other side, right? If you don't actually enjoy it, then you might be better off doing something else, I think.
That is true. That is so true, my friend. It's
Yeah.
so true.
Very nice. A lot of listen, we could talk about sharks some other time. We'll be here all the time, but I'm glad you said about Florida as well. It's one of my favorite places to go diving. On that note, maybe I'll send it in that direction then. Did you ever consider maybe going to practice down in the States instead of Canada? Like, what kind of pointed you to your courses there?
Um, so I've never actually had an inclination for the States. I don't know why. Maybe it's just me being silly. Um, and it's funny I actually mention that because I do have a younger brother who lives in the States. So I do have family there as well. I could use as a reason, but
Yeah.
I've never actually had a reason of going to the States. I don't know why, but Canada has always been appealing to me. I'm not sure if it's because it's so multicultural, and I don't know, but I've just never had that drive to go to the States.
Yeah. That's fair. And I think a lot of times too, when you find a place that you could picture yourself being and you say, all right, this is where I'm going, then you kind of stop looking at other places, right? Because you found a place that you could see yourself.
I
I
think
will
that's
say,
exactly happened. I think that's exactly what happened.
yeah. And I'm glad. I'm glad that you found the place and everything worked out for you. I will say, just being a local, someone that was born here, half of my family lives down in Florida, and that's my experience down there. I do anticipate, and maybe you let me know at some point, but the winters are cold here, man. And if you're coming from a place where it's warm, that's some culture shock in the beginning, right? Getting used to the Canadian winters.
It is crazy. I remember I was calling my mother and she was crying at home like, oh, it's so cold. I was like, what's the temperature there? She's like, it's 23 degrees. I'm like, what? I'm dying here. It's like -2. Like, what are you
Yeah,
talking about? So
exactly.
the weather is crazy, but I'm getting used to it. I learned how to work it. I made the best of any situation. Like I've made arrangements to go snowboarding, skiing, and so on. So whatever comes with me, I made the best of it. That's my style.
I love it. I hope you don't mind me saying, I love your mentality. It seems like the way you think about things, or that you kind of divide it up. It's sequential. This is what I have to do next, and I'm excited for this thing, and that's what I'm going to do. And I think that to anyone, embarking on this process, if there's any other IMGs watching, at least from what I've seen, what you need to know is that number one, it's a difficult process. Number two, it's a competitive process. And number three, a lot of it, like there is no certainty. Like you do need to have a lot of that faith in yourself and really make your contacts and your connections and see what has to come next. Gavin, if you don't mind, any tips that you could share for anyone going through the process right now about anything, feel free to say whatever you think is helpful.
All right, sure. Like you said, plan accordingly. I did find that I made plans to maybe not as crazy as me to do your exams the following day after landing in the country, but plan accordingly. Make sure you have sequential order. I do believe if you are practicing in another country, you should, as best as humanly possible, if you could delay your time until maybe like September, October, because it does, I think it looks favorable that you've been actively practicing medicine other than you've been here not doing anything for months and months and months. So I think that's one. Be confident, be assertive. Don't be afraid to call people. Don't be afraid of no's. Don't be afraid of rejections. You just need one yes. Um, and make sure you have a passion because I think what gave me the edge, well, maybe not, I'm not sure, but I think what helped me out was during my interview process. I was so passionate. I gave it my very all. I mean, it's the only interview I had, so I had to give it my best shot. So I think they did see my passion in general surgery, and it had helped me, land a spot. So you gotta have the passion. You gotta be assertive. You gotta be confident. You gotta reach out to people. You gotta network. Don't be afraid to reach out to residents in the program. They may know someone who may be able to help you, and that's how you get your tips. If you're doing the exams for NAC, practice, 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 practice. I had the opportunity of being in a residency program, so I practiced on my patients. I practiced with my friends. So it was almost second nature for me going into NAC exam. But practice, 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 practice. Yeah, and have faith. Don't do this thing with doubt. If you have doubt, that's when you start to stumble. So you got to be strong. It's rough, but it's doable.
Definitely. I want to ask, maybe more so for myself, or maybe some people might
Sure.
find it helpful too. Was there anything that you recommend when getting ready for the interview? Like, was there a specific process that you used to prepare, or did you just go over your own experiences? What do you think helped with that?
I did a mixture of everything. So like I said, it was my only interview. So all my physician colleagues, friends back home are here.
Hmm.
I had interview sessions with everyone. I didn't tell them what to do. I let them tailor it to their own liking, and that helped me because that's the variety that gave me that comfort, that gave me that confidence, and become comfortable in being comfortable with any question I'm asked.
Okay.
So variety is good. I did do an interview prep course, and that did help.
Okay.
Uh, yeah, so you just got to, like the exams, you got to practice, practice, practice. When I did my actual interview, I wasn't nervous. When the questions came, they felt like I've been through these questions already. I've had that calmness, that confidence to be able to answer, and that comes from practicing. So don't limit yourself. I asked every single person, even my aunt, I think I asked her to interview me, and she's not a doctor. So, you just got to make use of it.
Very nice. I am often asked by IMGs two
Hmm.
very specific questions. The first one is they ask me, do you need to have your Canadian residency before you apply to CARMS and stuff like that? I know it says so on their website, but because I haven't been through it myself, did you have your Canadian residency before you applied? Is that how you chose to do things?
Right. Yes, I did. I got my residency from hmm, March,
Hmm.
February, March. So I had it a while back, and I guess that was just a part of me planning. So I
Yeah.
made sure to look up the CARMS timeline, see what things are, and then I was like, all right, September is that sweet spot when I'll come. So
Yes.
yeah, yeah, I think it helps a lot. It helps a lot.
And I'll echo that. A lot of what Gavin's saying, I have also, when I was applying different situation, but planning ahead, looking at that timeline and laying it all out from when everything's due is going to be the biggest thing that you could do to set yourself up for success. And it's really sad to see the statistics every year of the people that start the CARMS process and then have to drop out because they missed some of the deadlines. That's always kind of heartbreaking to see that. So have everything laid out in advance. And then, Gavin, the last thing that someone asked me recently, and I said if I ever met someone else, I would ask them if you had to advise an IMG student, someone that's trying to match into, let's say, general surgery, what MCC score do you tell them shoot for this score? You want, this score ish.
I'd say above 250,
Okay.
but I will say though that for some strange reason, I think the NAC OSCE is what will give you that extra edge because reading through definitions and so on for the NAC and the objectives, it actually attests or tests your preparedness or readiness for residency.
Yes.
So if you get a really good score that stands out that yes, this person is trainable and is ready for residency. So yes, I think 250 is a good ballpark, but I do think your NAC OSCE is you really want a good score on that as well.
Awesome. I have heard that. You're right. Yeah, thanks for bringing that up. And it's like, wherever you can give yourself that added bonus, then you should, right? And the NAC OSCE, I think in recent years, there's really been that push to find candidates that excel there because at least in Canada, the way medicine's going is to have a lot more focus on communication and interpersonal skills as well. And you could knock these standardized exams out of the park, whether it's the USMLE or the MCC, but if you're not able to take that and apply it to person medicine, then that's a red flag. And that's what they're screening for as well.
That is true. I'll also add as well, I've heard it before. I'm not sure how true it is, but I've heard that they usually say to IMGs that the longer you've graduated from medical school may have a negative impact on your competitiveness.
Mm.
I graduated in 2016. That's 7 years ago.
Mhm.
But as I said, I was actively practicing medicine, so I'm not sure if that gave me the edge. So you got to weigh those things as well.
I think that it did. I think that it did. I know what they're referring to because I review the stats every year when they come out. And sometimes you'll see this gap and, someone graduated in whatever, 2017, 2016, and then there's this unexplained clinical gap where if you don't have some sort of explanation as to what's been going on, that might hold your application back a little bit.
True. That's right. That's right.
In any case, Gavin, I can't thank you enough, man. It was so nice of you to reach out to me, and you're so busy. You probably got all this stuff going on right now. But I hope that our talk today was helpful for other people going through it. And hopefully I run into you at some point, man, in Toronto. I don't know if we're
Yeah.
working together in the future, but do you have any
Yeah.
final things you want to say to anyone or anything like that?
Final thing to you is keep in touch. We need to keep in touch, especially with that shark diving. That's one.
Will do, man.
Uh, so the audience, again, be focused, be confident, have a plan. Make sure you stick to that plan. Don't deviate. There were times I felt doubtful and was like, oh, maybe I should apply for 2024 CaRMS or something, but stick to your plan. Take a shot. Don't be afraid of the risks. Like I said, I had one interview, one shot, and I got it. So if I could do it, you can do it. That's what I'll say to them.
Man, you give me goosebumps with that. We're so happy for you, and I'm sure everyone's rooting for you as well. Okay, so thank you again. Can't thank you enough. And to everyone else, thanks for stopping by today. We'll see you all in the next one. Everyone, take care.